Hi, my name is Dr. James Noble. I'm a neurologist here at Columbia University Medical Center. I'm an assistant professor of neurology in the Department of Neurology, the Taub Institute for Research on Alzheimer's Disease and the Aging Brain, and the G.H. Sergievsky Center. I lead a clinical and research group focused on sports-related concussions here at the medical center. So our question was the impact of the signing and the enactment of the New York State Lystedt Law on concussion management statewide among adolescents playing various sports. So in brief, the Lystedt laws have three basic tenets, and they include education about play and injury among all players and coaches and sideline staff. Number two, that every school must have an education plan in place for management and planned return to play following a concussion. And third is that any athlete who has a suspected concussion is removed from play on the day of the injury and does not return. So for our study design, we used the New York State Department of Health Statewide Planning and Research Cooperative System, also known as the New York SPARC system, which is an inpatient and emergency room database that's been present since 1979 in the state of New York. For this exploration, we looked at the dates of 2005 to 2015 and specifically explored emergency room healthcare utilization for concussions and sports-related concussions over that time frame of 2005 to 2015. Overall, the main findings were that we did not see a demonstrable trend in concussions relative to the enactment of the law. Typically, we saw anywhere from 3 to 4% of the annual visits for among this population were for concussions, and about 1% of overall emergency room visits were for sports-related concussions among adolescents over the study period. And if anything, we saw the most significant rise in emergency department healthcare-related visits for concussions in the years preceding the enactment of the New York State Lystedt Law, which reflects, generally speaking, the public awareness and interest in concussion laws. And indeed, our group even looked into internet searches for concussions, and there was certainly a spike that even began before the state law became either signed or enacted. One of our other major findings that we explored was the utilization of neuroimaging in the context of concussion. What is known is that the vast majority of individuals who have had a concussion really don't warrant imaging, including either CT or MRIs. And there have been major mandates, especially in the pediatric literature, to try to limit the exposure to neuroimaging, especially ionizing radiation. And that probably is the reason that there was actually a decline in the use of CT and MRI over the time frame of the study, with initially about 50 to 55% of all individuals in the study period, at the initial study period, getting an image, whereas by the end of the study period it was closer to 38%. And what stands out to me from this study is that while one can have a law, unless there is really substance behind its enforcement and tracking, the value of it is not so certain, sometimes until years later. So I think what the take home for me is that in order for us to have a meaningful policy in place, we really need to be able to track it at different levels. And it also underscores the importance of having disparate data sets and the limits that we have in monitoring major public health initiatives, unless we really have a comprehensive sense of what outpatient and inpatient and emergency room visits are looking like relative to a given health condition, and in this case, concussion. What are the next steps? It would be, I think, an open question remains as to whether or not these laws, if changed, could actually have a meaningful impact on healthcare utilization, access, and appropriate use thereof. It also remains an open question as to whether or not concussion is a healthcare disparity. And this could be also something to look at. That is, are individuals who are playing sports, are they exposed to more concussions and therefore experiencing a greater burden of health and illness and exposure to health care over time? Concussion has a lot of open questions, but we're starting to answer many of them, and we're hopeful that this study gets towards that goal.